Kenna, please unmute.
Welcome everyone to the first evening of the Newton-Wellesley Hospital Healthcare Career Exploration Series. My name is Kenna Thompson, and I am a member of the Workforce Development Council, which is planning this series. I am not an employee of the hospital, but actually work in real estate development with residential and commercial properties. Through my career, I've worked on small and large-scale developments, including hotels, conference centers, mixed-use properties like healthcare campuses, as well as residential family properties. But I volunteered to be part of this amazing group of people on the Workforce Development Council because of their commitment to improving career opportunities, especially with area youth. Our goal is to expand potential career options in the community in hopes of enhancing family financial security and helping to have a strong pool of talented people, such as yourselves, to work at local businesses. All of this ultimately translates to improved health and wellness for our community as a whole. Some of the council's key work includes the Waltham Summer Youth Intern Program, in which Newton-Wellesley Hospital sponsors on average 20 students in paid positions at the hospital each summer. And the council also works to educate students and adults in the community in healthcare careers across all levels, which is our focus in this series. And with that, I'll introduce Beth Downey, the Chief Information Officer for Newton-Wellesley Hospital and Chair of the Workforce Development Council. Beth?
Thank you so much, Kenna. Good evening, everyone. We're so excited to have you join us for the first of 4 panel discussions where you'll hear from healthcare professionals and their careers in various areas of healthcare. We will discuss their career journeys, the education requirements for their roles, and some of their day-to-day experiences. We'll provide an opportunity for you to ask questions of our panelists and understand their role and career journey to determine if it might be something of interest for you. So as Kenna said, my name is Beth Downey, and I'm the Chief Information Officer at Newton-Wellesley Hospital, and I'm also the chair of our Workforce Development Council, which is the host of tonight's event. I will be the moderator for each of our 4 events. We have additional events that will be held in November, December, and January. So hopefully you will be interested to learn more about other careers. So we would like to welcome everyone and invite the questions from all who are attending the event tonight. We have many different attendees at career night sessions, including students, teachers, parents, and current Newton-Wellesley Hospital employees. So we want these sessions to be as interactive as possible, as they can be in a webinar, and provide you an opportunity to ask any questions to the panelists. So we ask that you submit any questions using the Q&A function, and I will pose those questions to the speakers. So we're also recording this session, as you may have heard at the beginning, so it can be replayed for anyone who is not able to attend. So tonight's panel discussion will include a nurse practitioner, a pharmacist, physician assistant, and a psychologist. So the panelists will introduce themselves, and then I'll ask some starting questions, and then we'll open it up to questions that are submitted from the attendees. So I will now ask all of our panelists to turn on their cameras. And so I don't believe that our registered nurse Shannon has joined us yet. So we will hopefully see her soon. So we have Frances Lloyd, who's a nurse practitioner, Lena Nagorny, who is a pharmacist, Emily Hunter is a physician assistant, Ronnie Thomas is a physician, and Jennifer Del Rey is a psychologist. So I'm going to stop sharing the slides so that we can see all of your faces on the screen. Excellent. So what I will do now is I'll go around one panelist at a time and ask you to introduce yourself. So share a little bit about your role at Newton-Wellesley Hospital, where you're from, the schools that you attended, and how long you've been at Newton-Wellesley, and then we will get into some of the questions. So why don't we start with Frances?
There we go. I can unmute myself. Hi, I'm Frances Lloyd. I'm a nurse practitioner. I work at Newton-Wellesley Internist, which is a primary care office associated with Newton-Wellesley Hospital. I have been there for about 7 years. I guess I'll kind of start at the beginning. So in my previous life, I was a high school math and science teacher. And I then went back to school to get my certification as a registered nurse, and then also go directly from that to getting my master's to be a nurse practitioner. I worked for a number of years at Leahy Hospital before I moved to Newton-Wellesley Hospital. And in terms of kind of the things that I normally do, if you ever go to your doctor's office for a checkup or for a sick visit, those are the things that I handle. You could come see your primary care provider. You could come see me. So if you have a cold, if you have high blood pressure, anything like that, you would come in to see me. Oh, and I should say, so I went to Boston College for my nursing degree.
Excellent. Interesting that you started with a very different career. We can get into that after. Lena, why don't you go next? We'll go around how I have you on my screen.
All right, thank you for introducing me. Good evening, everyone. Again, my name is Lena, and I am a hospital pharmacist. I've been a hospital pharmacist for about 10 years now at Newton-Wellesley. And it all started with, I went to pharmacy school for 6 years at Mass College of Pharmacy, where I got my Pharmd Degree. I ended up doing rotation, my 6th year rotation at Newton-Wellesley Hospital. It was my institutional rotation. And after that, I got hired as a hospital pharmacist, and I've been grateful ever since. I really like what I do because one of the main reasons is because it is not repetitive. We work as rotating shifts, meaning we do something different every day. Just to get into a little bit about day-to-day routines, probably the biggest misconception about pharmacists is that they mainly just count pills. Which is actually not true at all. Even for retail pharmacists, that is not at all what they do. But I can speak for, as a hospital pharmacist, what we do is we verify orders, various orders for inpatients and outpatients on a day-to-day basis. We consult with physicians, with nursing, to basically improve healthcare for patients. Our ultimate goal is the best outcomes for our patients. We do various things such as rounding with clinical teams. We counsel patients. We check IV medications that our pharmacy technicians make. We are part of antimicrobial stewardship programs where we check labs, weight, renal function for patients, and make sure that everything is up to date, everything is correct. And if anything is wrong, then we want to consult our physicians and discuss with them, again, for better patient care. And the list sort of goes on as, again, every day we do something different, which is probably one of my most exciting things about what I do at work.
Excellent. Well, thank you very much. Ronnie, why don't we go to you next?
Sure. Thank you, Beth. Hi, everybody. My name is Ronnie Thomas. I am a physician, in fact, a first-year resident. So I went through medical school. I actually went to Boston College for undergrad, went to Albert Einstein College of Medicine in New York for medical school. I graduated last May, and I started my first year of residency at Newton-Wellesley Hospital back in June. So I'm in my 5th month, and I'll be going on next year back to New York to complete 5 more years of radiology training, specifically interventional radiology. But in my first year here at Newton-Wellesley, I rotate through multiple specialties, inpatient general medicine floors, surgery, ICU, emergency room, outpatient ambulatory medicine. So it's a whole host of things that I'll be doing this year. And next year, when I go back to New York, I'll be focusing more on my radiology training. And I can speak more as to my path here and what I will be doing in the future as questions arise.
Awesome. Great. Thank you. Emily. Oh, you're still on mute.
Hi, sorry about that. So my name is Emily, and I'm a physician assistant. For those of you who don't know what a physician assistant is, we are providers who can provide, various types of care at various, institutions, various specialties, kind of all across the board. We can see patients as an outpatient. We can see patients as an inpatient. I very specifically work as a surgical PA at Newton-Wellesley. A little bit about my kind of path to getting to this point. I started my sort of schooling at University of Connecticut. I got my undergraduate degree in exercise science. And then I went on right from undergrad to PA school, where I went to New York Institute of Technology on Long Island. And from there, I made the move up to Boston to start my career at Newton-Wellesley. And I've been at Newton-Wellesley for about 2 years now, working as a part of the surgical team. So we have a pretty solid group of, surgery PAs who also work with residents, as well as the surgeons and nursing and various other specialties. So that's kind of a little bit about my role, which we'll get into a little bit more later.
Excellent. Thank you so much. And Jennifer.
Thanks so much, Beth. My name is Jennifer Del Rey, and I'm a psychologist at Newton-Wellesley Hospital in the Division of Child and Adolescent Psychiatry. And my path to psychology started in undergrad as a psychology major, and then I took a couple of stops along the way, and I got a master's degree and an education specialist degree in mental health counseling, and then continued on to a doctoral degree in counseling psychology, all at Florida State University. Psychologists primarily are interested in the way people think, feel, and act. And so I spend a lot of my time talking with people about those kinds of things. I work primarily with children, adolescents, and families. And one of the things I really enjoy most about the field of psychology is that there are so many different avenues that you can take. And even, just today, I, did 3 very different kinds of things all throughout the day. So part of my job is psychological testing and assessment, where we assess, diagnose, and make recommendations for treatment. Then part of my job is seeing patients for other types of mental health intervention in our clinic, and then also working with some patients in the cancer center as well. So lots of different opportunities and ways to impact people's lives really positively in different ways, and also focusing not only on treating mental health concerns, but also promoting wellness and well-being and identifying people's strengths. And so we can talk a little bit more about the specifics as we move on, but thank you so much, Beth.
Oh, you're welcome. Excellent. Those were great. All right. So I do want to encourage any of our attendees, if you do have questions, feel free to start adding them to the Q&A section. I'm going to start in on some questions, but I want to make sure that we spend enough time. When we've done sessions like this in the past, we usually can't get to all the questions from the attendees. So I want to try to get to as many of them as we can. So here we go. Why don't we start with sort of, why did you choose to go into your particular field of study? So I'll go around again. Frances, why don't we start with you?
So as I mentioned before, I was working as a teacher, and teaching is something that I really enjoy. And a big part of nursing is providing teaching to patients about their health, about their chronic conditions, about what they're going through. And there's a lot of the same type of interpersonal interaction, getting to know people, building trust with people, establishing a relationship. And that was something that I really enjoyed about teaching. And I definitely knew that I wanted to head more into the healthcare field. And so nursing, and in particular being a nurse practitioner, was a great option for that. And I've definitely found that to be the case. As I was saying before, I see patients for routine visits. So there's patients who I've known for years, and they come back to, we keep on top of their chronic conditions, but they also come see me when they're sick. Like a lot of the other panelists have been saying, I really enjoy the variety of things that I do. So in primary care, we're kind of the gatekeepers for people's healthcare in terms of directing them where to go when things come up. So we need to be knowledgeable about a little bit of everything, so that we know where to send them and what resources they might need, or what other people they might need to see or consult with. So for me, that's kind of how I got to nurse practitioning.
Excellent. Thank you. Lena, how about you?
So actually, I sort of knew I wanted to go into healthcare. It's interesting because my mom and my grandmother were both pharmacists from Ukraine, and they were both pharmacists back in Ukraine. So I kind of also followed in their path. And also in high school, I was just more interested in subjects such as, math and sciences, chemistry, and it sort of just continued to verify the fact that in pharmacy school, I really liked organic chemistry, so that I was kind of on the right path. Again, healthcare really interested me. The only thing I kind of knew I wanted something that maybe had a little bit less patient interaction in the sense of contact interaction. So I knew I would never be able to be a surgeon or something like that. But a pharmacist was sort of a happy medium with that.
Excellent. Thank you. Ronnie.
Sure. So I guess, I'll sort of echo what has already been said in the sense that, and I think you'll find this with most of the people here on the panel today, it primarily stems from a desire to help your fellow brothers and sisters. And to me, I had always been interested in the sciences, and I always knew that I'd end up in a career in science. But what set apart medicine and healthcare compared to something like bench research or going into academic scientific practice was the human touch, the human interaction, and the fact that I could use my knowledge and my expertise to help patients. And that is what ultimately led me down this path. And it was something that I sort of gained an interest in from my youth. My mom's actually a nurse at Beth, and she'd come home and tell me all these stories about how, all these patients that she was helping and all these people whose lives were touched by healthcare professionals. And I always knew that that's what I wanted to do. So. Yeah.
Excellent. And have you done some rotations in radiology that has pushed you down that path?
Sure. Yes. Yeah. So for me, I always knew I wanted to work with my hands. I just wasn't sure to what extent. Initially, I was considering surgery, neurosurgery to be precise. And then I discovered radiology, and specifically interventional radiology, which, like Lena was mentioning, was a happy medium between the surgical lifestyle, but then also having some other factors in medicine that I could focus on, namely diagnostic imaging. And so for me, it was the perfect balance of procedures and diagnostics. So.
Excellent. Thank you. All right, Emily, how about you?
Yeah, so I always kind of knew that I liked science, specifically anatomy. In high school, I really loved my anatomy and physiology class. So that was kind of what guided me down that path, along with my mom, who was actually a nurse. So she had worked with a lot of physician assistants and really encouraged me to look into the career and talk to some PAs that she worked with about the profession itself. And I just really liked what they had to say. Like I said, I majored in exercise science in undergrad. So I was actually originally thinking I was going to go on to do physical therapy. But I decided to shadow both physical therapists and physician assistants, at the encouragement of my mom. And I just loved what the PAs did. I was lucky enough to be able to kind of, follow some surgical PAs and orthopedic PAs while I was still in, early in college. And that kind of helped solidify what I wanted to do. And so that's kind of how I ended up, where I was. And, specifically with regards to going into surgery, I really just loved my surgery classes when I was in PA school. I loved, my rotation when I was on it. And it was something that I just found that I was really passionate about. It was a good combination of, medicine and also procedural things, similar to Ronnie. So that was something that I, very much enjoyed, and ultimately led to my pursuing it.
Excellent. Thank you. And the important lesson is listen to your mother, because she usually knows what's best for you, right?
100%.
You might not always agree with her, but she usually knows what's right. Great. Jennifer, how about you?
Yeah, so I think that I've always just been interested in people. I've always been interested in, people's stories and sort of why do people feel certain ways about things, behave certain ways, how do things impact people differently, and just really learning about them and their story. And I always kind of saw psychology as kind of part science and part art, kind of in that way, that you get to use a scientific component and there is a research base to it and a scientific piece of what we do, but there's also a real human component to it and really getting to know people and to understand them and their individual situation. So I think that was always what kind of drew me to the field. And I think over the course of my training, it's about, on average, about 7 years of school after undergrad. There's lots of opportunities for practicums and internships and things like that that you need to do. So lots of opportunities to explore. And I just always found myself really primarily interested in children and families and, that dynamic, and always really enjoyed that. And I always really felt like the best part about psychology is that, we get to really look at what are also people's strengths. And I really feel like, a big part of what we do is helping people to bring out what was always there, that there were these strengths that people have. We may provide strategies, we may provide information that helps people to bring that out, but that's really a rewarding part of the job. And the fact that there were so many different opportunities where psychology is kind of a specialty in and of itself, but even within there's lots of different subspecialties and ways to impact people's lives in lots of different ways.
Excellent. Thank you very much. Okay, next I would like to move into sort of kind of the nuts and bolts of what it took for you to get to the role that you're in now. So I'd like for each of you to share, if you would, sort of your path to get here, like specifically where you went to school, what schooling, how long it took, what kind of certifications, exams, sort of all of that, to give our attendees an idea of what it takes. And I think this group panel discussion we have are the longest education journeys that we will have through our 4 paths, 4 different panel sessions. So what I liked about these discussions is we like to tell them sort of the good, the bad, and the ugly, to prepare them that, if this is what you really want, it could be a long, challenging journey, but can be very rewarding in the end. But just to sort of prepare people that if you do want to go down this path, this is what it's going to take. So Frances, why don't we start again with you?
Okay. I should add that while I work in primary care, nurse practitioners can work in many different areas in healthcare, both inpatient, outpatient. They can specialize, they can work in surgery, similar to what Emily does. So there's lots of different paths you can take once you're kind of on the path of being a nurse practitioner. For me personally, I got my undergraduate degree in biology. And you can certainly get an undergraduate degree in nursing. There's lots of ways to become a registered nurse or an RN initially. And one way is to go get your undergraduate degree in that. I did not do that. There are also a number of programs for those of us who did not have an undergraduate degree in nursing to then become an RN. And those vary. There's tons of them around the Boston area, but also all over the country. And each school is a little bit different in terms of how long it takes, but typically it is 2 to 4 years, depending on how it's done. A lot of people will get their licensing part-time while they're working or doing other things. So there's a lot of variability in how people do it. What I did was I went back to school at Boston College through what's called a direct entry program. So specifically for people who did not have an undergraduate degree in nursing. And that program is 2 to 3 years, depending on how you do it. And the first part of it, you take the coursework to become a registered nurse, and then you take the standardized test called the NCLEX so that you are officially certified as a registered nurse. In order to get into that program, you have to have a lot of prerequisites, some of which you would have, say, from a degree in biology, unless you were maybe too old like me and you had to take them again. And that might include things like organic chemistry, statistics, math, biology, things like that. So those are prerequisites if you did not already get them as getting your undergraduate degree in nursing. So in the direct entry program, once you've become an RN, then you do the rest of the program, which is to get a master's in nursing. There's a lot of changes going on right now in terms of what's expected education-wise for nurse practitioners. So when I got my degree back in 2010, typically people would get a master's degree. There's also programs where you can get a doctorate, and that's kind of where the profession is moving, that for nurse practitioners in the future, you may see more of them who have doctorates. So that does take longer and involves a research component kind of more thoroughly and kind of has an emphasis on leadership. So Boston College, where I went, now if you would like to become a nurse practitioner through them, you have to do it through the doctoral program. So that's kind of a change that's coming along. That's not the case at every institution. So the second part of the program for me was further coursework specifically about clinical things like how to diagnose things, how to prescribe medications, including, pathophysiology and pharmacology, but also doing clinical placements. I'm a family nurse practitioner, which means I'm certified to treat babies through geriatrics. So my clinical placements included a variety of things, including pediatrics, orthopedics, family medicine, and that again varies by program and what's available and what your interests are. So that might be somewhere where somebody would say, I really enjoy cardiology, and so their clinical placements would be more specific to that. After finishing my master's program, I then also had to get certified. I'm certified through the American Academy of Nurse Practitioners, and big, long, standardized test. And then once I'm certified, I also need to refresh that every 5 years. And you can do that by retaking the test. Most people do not opt to do that because that's not as fun, or by doing a certain number of hours of continuing education, going to conferences, attending webinars, things like that, to keep current on things. So for me, I had my undergraduate degree, I did some prerequisite courses, then I did 3 years of my master's program to get to where I am now.
Excellent. Thank you very much. Lena, how about your journey and what's required to be a pharmacist?
Sure. So in the past, actually, this was several years back, it was only required for pharmacists to get their bachelor degree. So that's just a 4-year program. It changed again several years ago, where now you actually have to have your Pharmd degree, also known as Doctor of Pharmacy. So that is usually a 6-year program, and there's various ways to achieve that. So probably the most typical way now is just to go straight after high school and just to do 6 years, which is actually what I did. There's also other ways as well. So there's several people that end up doing undergrad, and you basically just have to make sure that you have all your prerequisites, everything that is required, but ultimately the goal is to get your Pharmd or your Doctor of Pharmacy degree. And again, there's other accelerated programs as well. So I went to Mass College of Pharmacy of Boston, where there's just the 6-year program. At the end of it, you get your Pharmd degree. There's also Mass College of Pharmacy in Worcester, and that's the accelerated program. So what that means is basically they don't have your summers off, where we actually, one of the benefits is we had all our summers off. So then you get to, of course, take a break. You can, just work, of course, and you can figure out what you want to do if you want to go into pursuing retail or hospital pharmacy or some kind of pharmaceutical research. So there's, of course, plenty of things to do. You can also take summer courses. So there's different ways to occupy yourselves or just enjoy your summer off. But in the accelerated programs, they basically just go straight, which, to each their own. Some people want to finish school faster. So of course, there's options are available. There's other schools as well that are out there, maybe in other states too, that have accelerated programs. So again, for me, I did 6 years straight out of high school to get my Pharmd degree. So basically, I would probably say that the first 3 years are pretty similar to what, or definitely the first 2 years are similar to what any kind of other undergrad program might be, whereas it's a little bit more on the easier side. You have some, free time potentially for other things, to work more, to sort of socialize if you want, to kind of take advantage of that. Because I would say that the 4th and the 5th year of pharmacy school are definitely the most challenging, the most difficult years. So not to scare anyone, but that's probably the years where they try to, either get people to, if you can't handle it, then, maybe to switch to something else. But basically, because those are really the years that include all the types of classes such as that you'll really utilize in your careers, in your future profession. So that's like medicinal chemistry, pharmacology, therapeutics, which you'll study in both your 4th year and your 5th year of pharmacy school, your biochemistry. So really very challenging courses where we have plenty of exams. I remember it was one semester, I believe we counted with finals. I think we had about 18 exams. So it's definitely including finals, of course. So they kind of have them almost like every other week. So that was definitely very challenging. But it is worth it, absolutely worth it, because I definitely, I'm 10 years into pharmacy and I really enjoy and very grateful that I work here. And then, so I kind of mentioned now 4th year, 5th year. 6th year, there's actually really no education in the sense of exams or tests. You're sort of done with that after your 5th year, except for the big NAPLEX exam, which I'll get into. But yeah, your 6th year is really just rotations. So you actually get the choice to pick which rotations you would like. And sometimes, depending, how popular they are, you might get certain other rotations, but rotations are probably, the 6th year rotations are probably my favorite year, just because a lot of it is very hands-on. It's what you're going to be doing, in your future. And it just kind of verifies that you're doing the right thing, that you enjoy what you're doing. And because there's different rotations, you can do your institutional rotation, so hospital. You can do a retail rotation, like work in a CVS and a Walgreens, for instance. You can do elective rotations. One of the rotations I did was working in a animal hospital as an elective, which is pretty interesting and something different. So that sort of thing. You can do a clinical rotation where you get to round with physicians and actually go see patients, which is also very interesting, again, depending what you are into. So rotations, I thought, was probably the most interesting and rewarding year, just because, again, you get to see what you would like to apply for, what kind of job you would like to pursue in the future. So I definitely would take advantage of trying to, if you go down this path, if you to take advantage of seeking all the different opportunities you're given to, try the retail rotation, try the hospital rotation, try something more clinical, try something more in research, because maybe that suits you better. So I would really definitely want to tell everyone to try to get, experience everything that you can. So, and ultimately then you end up, after that, when you're done with your 6th year rotation, you have to take 2 exams. So those are your board exams. And if you pass that, then you end up getting your Pharmd Degree, and then you're pretty much done. You're a pharmacist. So that's your NAPLEX, and then also your pharmacy law. And so MCP and other pharmacy colleges, all the colleges that are accredited, they do a great job for preparing everybody to pretty much, there's a very high passing percentage, very low failure rate. So that's definitely very good in that sense. And once you're done, you study for that. There's various sources, different books you can use to study, to help you study. You pass that, you end up getting your, you graduate, you end up getting your Pharmd Degree, and then you can continue to pursue, whichever path it is that you chose. Whereas for me, it was hospital pharmacy. And another actually credential that I have that is not required at all, but I believe maybe in the future years, they might make it mandatory, is I have BCPS, which is Board Certified Pharmacotherapy Specialist. So you can actually get that credential, but you have to work in hospital pharmacy for 3 years, at least 3 years. So after you work in a hospital pharmacy about 3 years, then you can, what you do is you just end up taking an exam. And if you pass that exam, you can get that certification. And then to maintain that certification, so as Frances was kind of mentioning for in her career path, same with us, there's 2 different ways to maintain it. You can either continue to do continuing education. There's about 120 hours of continuing education you have to do in 7 years. Or you can just take the exam over again, which I think for me, I would rather do the continuing education than study all over again for an exam. But there's different options. But there's lots of other credentials you can get, certifications, if you want to specialize. So BCPS, which I'm certified in, that's just general pharmacy, but there's also oncology. If you're interested in treating cancer patients, there's geriatrics, there's cardiology, infectious disease. So lots of different paths you can go into, of course, and that's mainly sort of if you want to pursue your career in hospital. I believe all these credentials you don't really need if you want to pursue a career in retail pharmacy or research. But again, there could be other things. Other things that I know that people did is go into residency, which again is not required yet, but that could potentially change in the future. You can do 1 year or 2 year residencies, and also fellowships. Fellowships are mainly for pharmaceutical for research, pharmacy research.
Excellent.
Just some details.
Yeah, great. I do have a follow-up question for you. That accelerated program for Mass College of Pharmacy, how long does that one take compared to the 6-year program that you did? Do you know?
So that one, I believe, actually, if you did your undergrad, depending what credentials you have, because those you can kind of cover you. I think it's a 3-year accelerated program. So it just goes straight for 3 years. There's no breaks besides, I believe, just the Christmas and New Year's, like week or 2 weeks that you get.
So that would be 3 years on top of a 4-year bachelor degree?
On top of 4-year bachelor's, yeah.
Yeah,
exactly.
okay. All right, excellent, thank you. Ronnie.
Yes, the question I've been dreading, but also am excited to answer. I could take up this whole talk talking about all the different ways to get through medicine, but I'll sort of start off by giving an outline of the journey that I went through, and then maybe touch upon a few of the other alternative pathways that people tend to take. So I went to undergrad at Boston College for 4 years, majored in biochemistry, minored in medical humanities. In that time, I was officially designated as a pre-med student, and that meant I would take classes usually that were concurrent with my degree in biochemistry, for biology, organic chemistry, physics, statistics, some fine arts courses, all things that, all degrees that, or all courses that medical schools required prior to admissions. I had colleagues who majored in English, majored in the arts, but as long as they were pre-med, they were taking the biology and chemistry, physics, all these other classes concurrently with me. And after I took all those courses, I took an exam called the MCAT, which is the Medical College Admissions Test, the score of which determines or is factored into the determination of acceptance into medical school. And medical school admission is a holistic process. So in addition to the coursework, your GPA, the MCAT score, there are additional factors that are looked at, including sort of clinical and other volunteering time. So I did bench research between 10 to 20 hours a week, mostly in my first, second, and third year of college, in a few labs, both at Boston College and in the city. Also was an EMT and worked on an ambulance for 2.5 years to get some hands-on clinical experience and to be exposed to the field. Did some shadowing with physicians, which I think was the most important part for me personally to solidify my my interest in medicine and to sort of, you know, assure me of the path that I was taking forward. I was also an RA, so a few other things in college, all of which contributed to my medical school application. And I went straight through medical school or college and medical school. What that means is I applied at the end of my third year of college to medical school, and I was interviewing between the end of the summer of my third year and the early parts of my fourth year of college, and got accepted into medical school prior to graduating college. And that meant that I was able to start the September following my college graduation in May, with a little summer break in the middle. And then once I was in medical school, I was 4 years. The first 2 years are focused on the basic sciences. So you're mostly in the lecture halls, getting different lectures and different topics, ranging from anatomy and physiology to pathophysiology to clinical introduction to clinical medicine, to how to talk to patients, you know, how to interact with other healthcare professional staff, ethics classes, statistics classes, but mostly focused in the classroom setting. And at the end of those first 2 years, you take healthcare. The first exam of your USMLE, which is your United States Medical Licensing Examination, one of 3 parts, which will ultimately grant you your medical license at the end of it. It was an 8-hour exam at the end of my second year. And once you pass, right now it's pass fail, but when I took it, it was for a grade. After you finish that, you move on to your 3rd year of medical school. And in your 3rd year, you rotate through the different specialties, ranging from internal medicine to surgery to OBGYN, pediatrics, outpatient family medicine. And it's sort of the idea in 3rd year is to expose the medical student to as many different practices of medicine as possible, because every single specialty has a different way of incorporating the basic sciences that you learn in the first 2 years to apply to a patient in the setting that they present in. So, and by the end of that 3rd year, you sort of have an understanding of what specialty you want to pursue, and then you start preparing your application for residency. So at the end of your 3rd year, assuming you've figured out what you want to do, you send in your application for residencies, and throughout your 4th year of medical school, you're interviewing with different residencies all over the country in the specialty of your choice. And ultimately in March, you find out where you end up, and you move on to residency training. And so I am now a 1st year resident. There's different nomenclatures for physicians that can be a little confusing to people. I'm a 1st year resident, which is also known as an intern. As soon as you become a 2nd year resident, you're no longer an intern, you're just a resident. And residency can be anywhere from 3 to 6, 7, 8, 9 years. So from years 2 through whatever else, you're just a resident, not an intern. And then once you finish your residency training, you're referred to as an attending physician. And if you choose to take on more training after residency, you're referred to as a fellow. So that's fellowship. So for me, at least, I'll be doing my internship at Newton-Wellesley Hospital my 1st year. And then for radiology training, interventional radiology training, I'll be returning back to New York to Montefiore Medical Center in the Bronx for years 2 through 6. It's a 5-year program. In the first 3 years, I'll be doing diagnostic radiology, which is mostly learning how to read diagnostic images, CT scans, X-rays, MRIs, doing some procedures. And then in the last 2 years, I'll be focusing on my interventional skills. So doing mostly ports, catheters, endovascular procedures, grafts, stenting, and a whole host of different things that are still being worked on. So that's my path. And in total, it takes about 14 years, 4 years of college, 4 years of medical school, and 6 years of residency. And that is the shortest path that I could have taken to end up in interventional radiology. Realistically, people come from all different trajectories in life. I have friends who had 2nd careers, 3rd careers. Even the oldest medical student in my class was 41 years old. He was a lawyer beforehand. He was, very established, and decided he wanted to go back to medical school. So if you decide after college that you want to go back to medical school, because there are those prerequisite requirements, some people, especially if you majored in something that wasn't scientific, for example, people who are in communications or English lack the scientific curriculum that they look for in medical school applications. You can do a master's program called a postbac, which is between 1 to 2 years, in which you can take an accelerated course focusing on the sciences. You take the MGAT and then you apply. So my sister actually took an extra year off, and she did that course, and now she's a 1st year. So she took an extra year between her college years and her medical school. And then once you get into medical school, some people tend to take research years. So I have colleagues who started with me in my 1st year, but decided to take 1 or 2 research years before applying to residency. So that's depending on your personal interest, and depending on what specialty you're interested in, you're sort of obligated to take extra research years. For example, in dermatology or ophthalmology, between 80 to 90%, so a percent of applicants do take research years to bolster their application. And then once you start residency, you also have the option of taking further research years. For example, in general surgery, if you want to go into colorectal or pediatrics or CT surgery, people tend to take 1 to 2 years of extra research years to both focus on the field and also bolster their application. And with that, I'll sort of quickly summarize all the different pathways you can go through after medical school and in residency. So the big branch that the majority of medical students end up choosing is internal medicine. Over 60% of medical students go through internal medicine residency, which is 3 years. And at the end of those 3 years, you have a few options. You can either choose to stop your training there, which means you'd be an attending internal medicine physician, and you can focus on either outpatient or inpatient medicine. If you're outpatient, you'll be seeing patients in an outpatient primary care setting. If you're inpatient, you'll be a hospitalist taking care of hospital patients. You can also choose to do fellowships in different specialties like cardiology, nephrology, rheumatology, infectious diseases, and those are anywhere from 2 to 3 years, sometimes even 4 years of post-residency training fellowship, and that would give you the expertise necessary to focus on patients in specific populations. And the other big category that people tend to go into is surgery, and within surgery there are different branches as well. There's general surgery, after which you can do colorectal, CT surgery, vascular surgery, surgical oncology. There's also these smaller subspecialties of surgery. You can go into directly after medical school, neurosurgery, ENT, urology. And then there's radiology, which is what I chose. And within radiology, I chose interventional radiology, which is a new path, which we can talk about once we're there in a couple of years. And there's pathology, there's dermatology, and a few others that we can go into more detail on if people have questions. But it's certainly a long path. It's very interesting, and you have a lot of options. It's challenging, but it's also very rewarding at the end of the day. And I think that's why most of us do this.
Yes, you definitely have to have a passion for it if you're going to go through all the years that you have all gone through to get to where you are today. Excellent. Emily, would you like to share?
Yes. Sorry, this is my needy cat who's
that is
very
okay.
needy. So PA school, so historically, people who went to PA school when the career started, it was typically a second career for people. So people who had done other professions, were interested in healthcare, had maybe had some experience, but weren't really clinicians, could go to PA school. That has very much changed over the years. Many people go to, their undergrad school with the sole purpose of being a physician assistant. Like I said, I was a little bit torn, between PA and PT, but, so typically, like kind of the path that I took was no matter what PA school you go to, for the most part, you do need a bachelor's degree. So that bachelor's degree can be in anything similar to med school, but there are certain prerequisites that you're going to have to meet, mostly in a lot of the different sciences, biology, chemistry, anatomy, things like that. There's going to be certain requirements you have to meet. So typically it is easier to choose a science degree. But I do know people who, chose degrees in various other specialties as well. But so you need, the kind of the key things that you need is you need a bachelor's degree. You need to take the GRE, which is, a test that a lot of grad students, it's very generalized. Some schools require it, others do not. And I think that a lot of that's changing, and they're moving away from standardized testing as a factor in admitting people to school, because it's not, reflective of the person as a whole. But in general, some schools do still require it. And the other big thing that's needed for PA school is clinical hours. So a lot of programs will require you have a certain number of clinical hours, because, PA school, it's a long journey. Which I'll kind of get into a little bit. My PA school was 3 years. So I did 4 years of undergrad plus 3 years of PA school. They want to guarantee that you want to go into healthcare. So they want you to have some sort of A, shadowing hours, that you know what you're getting yourself into, and B, that you have some clinical experience. So I, part-time during undergrad, worked as a certified nursing assistant. I worked in an assisted living facility taking care of patients. It's challenging work. And I was able to kind of do both school and that. I would do that during my winter breaks and occasionally come home on weekends to do it. A lot of people need to take a year off after undergrad to kind of build up those hours, because depending on the program, they can require as much as 2,000 hours, which is a full year. That's equivalent to like a full year of working. So I think that's where like most people struggle, is getting those hours, and that's why a lot of people will take some time off. More and more people are going right from undergrad to PA school. And that can happen one of two ways. Number one is you can, get your hours while you're in your undergrad career as a CNA and EMT, something along those lines, and apply, as you go and go right from undergrad. And then the other option is more and more schools are creating programs that are have basically like a combined program where you'll do, 3 years of undergrad and 3 years of PA school. And so that you have to know going into college that that's what you want to do. But that is becoming more common for people to do. PA school itself can range anywhere from 2 to 3 years, if you're doing just the graduate program. So my program was 3 years, but that was mostly because it was a little bit more spread out. We had 2 years of didactic. We treated our first 2 years as if it was an undergraduate kind of like schedule. So we had a summer break, we had a month for winter break, things like that, which I liked because it kind of split things up a little bit. And so my first 2 years were didactic, meaning it was just like all kind of like book learning. We did some skills classes, we did, anatomy and cadaver lab, things like that. But that was all kind of like the learning process, the learning experience. And then my third year of PA school was clinical rotations. And that's where, similar to the other professions, we go around to different sites. There's certain rotations that PA schools have to have their students do. Because something, that's great about the PA profession is that we're trained as generalists, so we can go into a variety of specialties. So they expect us to have a pretty broad background and experience a bunch of different types of specialties while we're in school. So that's kind of the third year is rotating around those different specialties. And at the end of each rotation, we take an exam to make sure that we're on track. To eventually take our boards. So at the end of PA school, I had to take a board exam. It's called the PANCE, the PA and National Certification Exam. And that is the test that we have to take in order to become certified. So to kind of like summarize, basically you need a bachelor's degree, whether or not that's part of a combined program or you get your bachelor's degree. Some people, will take a year off in between PA school and undergrad and PA school. Some people choose it as a second career. So there'll be, there was some nurses in my class. There was, people from various professions who that was their second career. And they had to go back to school to get some of the prerequisites and then start up PA school. So again, there's lots of different paths. If anyone has specific questions, I'm happy to answer more later. But that's kind of the basic path of how to do it.
Excellent. Thank you. Jennifer, we'll have you round us out.
Yeah. So this is so exciting hearing about everybody's past.
I know. I love to learn all about it. I wish there were programs like this when I was in high school to have learned more about various careers.
Yeah. It makes me miss school because I always loved school, but it is a really challenging time and it is a really big commitment, but it's also a really exciting time because you're really, learning so much, you're getting all this experience and you're really getting so deep into kind of a knowledge base about something that you feel so passionately about, that you feel so strongly about. So I went into my program after 4 years of an undergrad degree, and I had a choice. So I could take 2 different pathways. There is one option where you can just go straight through from after undergrad through to a doctoral degree, or you can get a terminal degree along the way, like a master's degree or an education specialist degree or something along those lines. Advice that I was given by one of my favorite professors was, he suggested taking the path of getting a terminal degree along the way. It does take a little bit more time. But he said to me, you never know what life has in store. He said, so if something happens along the way, along these, 7 years, 6, 7 years, and you need to take a little bit of time off from school, you have a degree that you can work with in this field and accrue clinical hours and things of that nature. So that was his suggestion. So I thought about it a bit. And at that time, an extra year sounded like a really long time, but I decided that was the path that I was going to take. So I did get a terminal master's degree and then continued on to a doctoral degree. Some schools, like the school that I went to, I was able to apply some of my credits from my master's degree to my doctoral degree. So I was able to make up a little bit of time with that. But I found that the deeper I got into the program, I wasn't quite as concerned about making up time because I really wanted to take the time to explore all the pieces that I wanted to explore and have all the experiences that I wanted to have. So, there is, standard coursework that you take and, all kinds of things, biological bases of cognition, behavior, statistics, and all different kinds of classes. But pretty quickly, you start into some practicum and things of that nature where you're getting experience in different settings. And in my program, we had some choice about which practicum we wanted to do. Some were required, but you do have some choice in that. And so that's really an opportunity where you can try out different things, try out all these different areas of psychology and, you know, what you might be most interested in. So for example, there are options to work with children, there are options to work with families, with adults, options to work in health psychology, options to work in industrial organizational psychology and in more kind of business settings, forensic psychology, you know, educational psychology, all different areas. The pieces that I always enjoyed the most were related to working with children and families. I also did a lot of training in forensic psychology, and I really enjoyed that quite a bit. And then I also always found myself very interested in the coursework and the experiences related to how people learn. So I did quite a bit of clinical experience and things of that nature related to educational psychology and, you know, cognition and how people learn, how people develop in those different kinds of ways. So there is a lot of flexibility in that way in terms of different kinds of experiences. Once you get to the end of your coursework and the end of all of your practicum, then you apply for internship. And, you know, it's called match day, and, you know, you find out kind of where you matched and all those kinds of things. And then you kind of go off to a year-long pre-doctoral internship before you finish school. And then in my program, you can take a couple of different routes. There's a PsyD, so a doctor of psychology. There's a PhD, and then there are also some programs that are EDDs. I took the PhD route, so I did also have to complete a dissertation, so a research project, and write up the whole dissertation and go through a dissertation defense. The other component is that as you're getting ready to go off to internship, there are some exams that you have to take kind of within your coursework. And so there's a written exam, it's a week-long. In my program, it was a week-long exam that you had to do different parts of it every day for a week. And then at the end of that, you would go and have an oral defense where after you did the written part, you had to go in and orally answer questions about different components of the exam, defend your answers, you know, things of that nature, or take new questions kind of on the spot. So there's a lot of preparation that goes into that piece. And then you go to internship and you have a year-long experience of training there. And then after that, you know, assuming you've completed everything else by the time you've gotten to your internship, then you can apply for licensure. And so actually, no, I'm sorry. There's another step along the way. After you graduate, you have to do another year of supervised training, supervised practice before you can apply for licensure. So you apply for licensure. You know, and then you also have to take two different exams. You take a national exam, and then you also take a state exam. And then, you know, after that, you know, so that you can't use the term psychologist until after your license. So it's designated by license, not by education. And then after that, you have to renew your license every 2 years. And that happens through accruing continuing education credits and then, you know, submitting all of your paperwork and documentation. And it's about 20 hours every 2 years of continuing education that goes into that. So I enjoyed the process. It is long and it is certainly a commitment, but if it's something that you really believe in and something that you really feel strongly about, it is also an enjoyable process.
Excellent. I'm exhausted listening to what you guys have done. It's remarkable when you hear it laid out there, how much work you have all put in to get where you are today. It's amazing. And I'm sure you're very proud of yourselves and your family is proud of you for everything that you've accomplished so far. So I have some additional questions that I want to ask, but we have received some questions from our attendees. So I do want to get to some of those. So the first one, Francis, I think I'll pose this to you. Unfortunately, our nurse, Shannon, wasn't able to attend at the last minute. So, but Francis, I think you'll be able to handle this. Can you explain the difference between a nurse and a nurse practitioner?
Sure. So a nurse practitioner, the key difference is that we can prescribe and treat and diagnose. Those are the key things as a medical provider. So while if you're in the hospital, a nurse can give you medication, they can't decide which medication to give you. They still need to know all about it and how it works and whether it's safe and all those things. But you need a provider, either a PA, a nurse practitioner, or a physician to say, this is the medication that you're going to get, or to also say, this is the problem that you have. You are having a heart attack. And so the diagnosis and then the prescription of medications to treat, those are the key differences between a nurse and a nurse practitioner.
Excellent. And nurse, I believe now in Massachusetts requires a bachelor's degree. And then nurse practitioner, you said, is a master's degree.
So there's also licensed practical nurses, which
Yep.
are different than registered nurses.
Registered nurse.
Less years of education for that, but I do believe you need a
Yeah.
bachelor's in nursing in Massachusetts now.
Thank you. So along those lines, I will add my own question in here to Jennifer. Can you explain the difference between a psychologist and a psychiatrist?
Yes. So a psychiatrist is a medical doctor who went to medical school, and a psychologist is not a medical doctor. So a psychologist would take the path of a PhD, a PsyD, EDD, but does not go to medical school. And also there are some things that are starting to change a little bit in terms of prescribing in some states, in terms of psychologists being able to, there is some exploration in the field about those kinds of things, but in general, psychiatrists prescribe medication and psychologists don't.
Okay. And then also, Emily, physician assistants can prescribe medication. Is that what Francis had said?
Yes, so physician assistants can prescribe medication. We can also diagnose, treat. In general, physician assistants and nurse practitioners are very similar in what they can do, very different in the approach of how they get to that point. The education and schooling process is very different. And I think you'll see a little bit more, nurse practitioners and physician assistants tend to gravitate towards different fields. But yes, we can prescribe, diagnose, treat.
Interesting. Okay, great. Let's see. I'm not sure. This question potentially could go to Ronnie or to Jennifer. It's about becoming a psychiatrist. So neither of you, I realize, are that, but I'll ask the question and see if you feel comfortable answering it. What can you do in high school to increase chances of getting into a good college if you want to become a psychiatrist? Who wants to take that? Anybody?
I can take that question.
Okay.
So, I mean, in terms of what to do in high school, I would say the focus in high school should be to get into a good college, to get into a good medical school, if psychiatry is what you want. And Jennifer can speak on psychology and the path that she would take for that. Once you get into college and medical school, you can consider shadowing a psychiatrist. You could even do that in high school to see if that is really what you want to do, and speak to other psychiatrists or psychiatry residents to see what path they took to get to that point. As far as getting into a psychiatry residency, there's not much that you should be doing in high school for that. Your focus should be on getting a good, well-rounded education in all the fields in college and medical school.
Excellent. Okay, thank you. I'll throw this question out to anyone who wants to answer it. Did you do specific things like volunteering or interning in high school to get into your dream school? Anything anyone wants to share?
I mean, I could take a little bit of that. I think that, I did do a lot of volunteering in high school, but I don't think at the time I really considered it something I was doing specifically to get into a particular school. I think that what it was a real opportunity for was for me to kind of explore things that I thought I was interested in at the time, to learn more about it and to get a sense of sort of overall, where do I see the vision for my future? So I think it was really an educational experience for me and a big part of my development growing up, in terms of thinking about, this in a broader sense of sort of what are the things I'm interested in, what are the things I value, what are the things that are important to me. And, I think that all helped shape my decision-making going forward. So I think that was where I found the real, value in that I felt pretty strongly about, that it's important to give back to the community and to find ways to do those things in the communities that we live in. But I think looking back on it, the bigger lesson for me was really that it was helping me to develop those pieces about myself that help my decision-making going forward.
Excellent. Anyone else
If I could add, if I could add something to, maybe to sort of touch on like the motivation behind that question. I'll speak to medical school at least. There's this common misconception that to get into medical school, you have to have gone to a prestigious college and done, a biochemistry or biology degree and had the cookie cutter path to medical school. I think the current thought and sort of the current consensus is that more so than the school that you do attend, it's the experiences that you do garner in those years that matter more. And I have colleagues who work with me now who are physicians who went to big name Ivy League universities. I have friends who went to community colleges and worked their way up into 4-year undergrad universities. It's more so what they did with their time that set them apart when it came time for medical school admissions compared to where exactly they did go.
Excellent. Anyone else have anything they want to add about something they may have done in high school or that you would recommend someone do? All right. Let's see. Francis, this one I think I will pose to you. So they posed the question, I need some advice and help. I will start my clinicals at the beginning of next year, and I would like to know if there's any possibility to get a preceptor for family nurse practitioner at Newton-Wellesley Hospital. What are the steps to follow? Is there even a process for that?
Sure. So the nursing education department at the hospital handles that. And you can certainly reach out to them and they will try and help you find a placement. I will say it is very challenging, especially right now, kind of with COVID going on, to find a preceptor, but we do have many clinical placements at the hospital. I myself, I'm a preceptor through Boston College, so I have one of their students every year. You can also work with them. The Mass Coalition of Nurse Practitioners, they also help people, they post for preceptorships and clinical placements and things like that too. But reach out to the nursing education office at the hospital.
Excellent, thank you. Let's see, this question, it says, I understand this first session is regarding roles that require the highest level of degrees, the most amount of schooling. Being a 26-year-old, what advice would you give me? Strive for roles that require less time. People tell me it's never too late, but I currently just started at Mass Bay Community College with no college credits yet. This is why I'm interested in career exploration. Anyone want to tackle that and give that person a little advice?
So I did some of my prereqs at Mass Bay many years ago. I would absolutely say it's never too late to go into a field that you're interested in and that you want to do. So as you get older, it's probably more important to have a little better sense of what it's like. I think it's even more important to have shadowed somebody, to have gone to a talk like this, to really know what you're getting into. But then ultimately, it also comes down to other lifestyle choices in what matters for you in your family, your financial situation, and things like that. These are big time commitments. They're big energy commitments, the big financial commitments. And there are certainly ways to do it. I had my second child while I was in the middle of my master's program, so I took an extra year to do it. But I needed to be able to do that. I also worked while I was doing my master's program so that I could gain more experience as an RN and pay for my education. But you have to know if you're feeling like you're up to taking on those types of things. But I also had someone in my master's program who was in their 50s. And that's what they wanted to do. And she's now practicing and happy and doing great. So the more important thing is your motivation. If it's what you want to do, you can make it work.
Excellent. They always say, love what you do, and then it's not a job. Anyone else want to add to that? I think that was some great advice.
It might be helpful just to see if there's a career center or a counseling center at your college, because sometimes they have some information about different career paths or some different kinds of resources that can help you, think through different paths and different, options for decision making. But that's so exciting. I'm excited for you.
Okay, I have another long one I'll read. This one's someone looking for some advice. So this person has 2 degrees, a BA in journalism and an MFA in film and media arts. So not anything healthcare related. After their daughter was born, became generally interested in psychology, but has no idea, does not have any academic background in healthcare. What is the best possible way for them to work with healthcare workers or get into a career related to healthcare? What preparation do they need before that? Any advice anyone would like to give?
I guess, obviously not necessarily speaking from a psychology standpoint, but I think, a good place to start is even just to go, to your local community college and start taking some classes. Because I think that can help like reinforce, that you do want to pursue that path. And B, it kind of gives you that flexibility to get some of your prerequisites without, kind of like allowing yourself to have that work-life balance. So I think that is like a good place to start, would just be to kind of like look into classes at your local community college and kind of get an idea for what's available and what kind of prerequisites you could do there.
Excellent. Anyone want to add to that?
There are also lots of opportunities to work in healthcare in a variety of roles. So when this person is saying, they want to be in healthcare and in psychology, there are peer counselors, community counselors, therapists, support groups. There's so many different ways to get involved. So, reaching out to do some volunteer work, finding an area that you're interested in may help kind of winnow that down for you a little bit, because it may not be that you necessarily want to spend years and years becoming a psychologist, but that you want to work with people who have substance use disorders and you want, be in that kind of setting. So there may be other ways to do that. And until you kind of get into the field a little bit, you may not know what the opportunities are.
Yes, and it's a perfect plug for our next session, which will be November 17th. I just wanted to check my notes. We will have a mental health specialist, social worker, community health worker, along with occupational therapist and child life specialist. So those are roles that take a little less schooling, but potentially, especially some of those could be a little more focused in the area of psychology, but could get you started in that direction. So I encourage that person to, if you're available, attend our session again on November 17th, and you'll get a little bit more information that might help you start down that path, which is great. Let's see. Are there many people that begin their career as a nurse and then move into physician assistant school? What would that transition look like? Emily, what's your thoughts? You see a lot of that? Or Francis, you might see some.
I've seen a lot of it. I think that more commonly, if someone's a nurse, they will often go on to become a nurse practitioner. That being said, I did have, I believe, one person in my class who had gone to nursing school, had then, worked as a nurse for a couple of years, took a few extra prerequisite courses, and then applied to PA school. So it can definitely be done. I don't think it's the most common path for kind of like advancing on to like kind of that practitioner level, but it can definitely be done. And I've definitely seen it done.
Excellent. Okay, I'm going to go back to a couple of my questions because I want to keep an eye on the time, and we've already been at this for an hour and 15 minutes. So I'd like to ask each of you sort of what is a typical day like for you? So Francis, why don't we start with you?
Sure. So I see patients for scheduled appointments between 8 and 4. And so on a typical day, I work in a practice with another nurse practitioner and 9 physicians. So it's a pretty busy place. So most days I have some set appointments. People come in to see me for a physical or to get their blood pressure checked. But then I always have some spaces for more urgent things, people who have acute problems or sick and they want to come in. Every day is very different. I might see all sick visits one day. I might see 6 physicals in a row. I see patients 18 and up. So some days I see 5 people in their 90s. It's all a little bit different. In between, actually, going into the room, talking with the patient, doing whatever we need to do there. I'm also answering phone messages from colleagues, looking at lab results, radiology results, writing letters to patients. I fill out a lot of forms, and then after I see the patient, of course, I have to do a lot of documentation. So there's a lot of computer work involved in it too, in addition to the actual, kind of seeing people and laying hands on them. I personally do not do any call. A lot of nurse practitioners in my situation might, take phone calls in the evening or on weekends, but I personally don't do that.
That's great. Excellent. Thank you. Lena, what's a typical day like for you?
Yeah, so as I mentioned, we do rotating shifts for the most part. And what that means is we have our schedule out for several weeks in advance. And for the most part, I work as a day pharmacist. So usually my shift starts around 7 a.m. and goes till 3:30. But then again, sometimes we have to cover other shifts. There's other typical shifts like 8:30 to 5. And then there's shifts like 6 to 2:30. And also you can kind of work around with your supervisor. Some people have kids, for instance, and, they want to be more flexible and if they have to pick up from daycare, things like that. So that's flexible too. There's other shifts like you have to cover weekends, you have to cover evenings, so all sorts of things. But for the most part, it's about 7 to 3:30. You come in, and again, because it's rotating, so it really depends what you're scheduled for on that day. You can be scheduled, for instance, in the IV room where you check intravenous medications, like any medication that goes into the IV, IV antibiotics, IV pressors like norepinephrine, epinephrine, things that are for immediate use, like for the emergency room. You check intravenous medications that go to outpatients or inpatients. You make sure enough medications are batched. You sort of work together with the pharmacy technician to make sure that everything goes smoothly. And so there's enough medications that are prepared for the evening shift or for future days ahead. So that's if you're sort of on the schedule for the IV room that day. If you are on the schedule just to verify various floors or to take care of certain floors in the hospital, usually what you would do, or what a typical day would be like, is you have to sign into something called a vault system. So you have to be in constant contact with physicians, with nursing, to make sure that if there's any errors, any discrepancies in medications and dosages that you see, you want to constantly be in contact with them, and they want to be able to be in contact with you too. So that would probably be one of the first things to do, is to sign into that system so you can communicate with other healthcare providers in the hospital. Then you would go on to you take care of certain floors that you as your described role for that day, like intensive care unit or emergency room or outpatients for that day. And by verifying, I mean, you want to make sure that all the doses are correct, that the times of when the medications are scheduled are correct. You check lab work for the patient, for instance. You check like their renal function, you check their liver function, you check, list of medications that they were on prior to admission. And if you see any errors, you see any interactions, what you would do is you would just use that vaulting system. You would contact the physician or a nurse and to let them know that you are currently working on that or you're fixing that error. So that's kind of what you do all day long. In between, there's also other things that you do. You constantly, because we supervise pharmacy technicians, we constantly make sure that there's sort of a smooth transition, that pharmacy technicians are delivering, sending medications off to the floors. So we don't get constant phone calls about where medications are or if something wasn't delivered, and just sort of a smooth process like that. Another thing that we do at some point throughout the day, as I had sort of mentioned briefly, is we're part of this antimicrobial stewardship program. So we want to check a medication called Vancomycin, which is an antibiotic. And we want to check and make sure that the patient's renal function and all other lab work is in range and where it's supposed to be. If anything is abnormal, we would contact the physician. We would give them our advice and what we think would be the appropriate dosing. for that. We also try to switch patients, potential patients, for instance, patients who are about to be discharged from IV medications, intravenous medications, to oral medications to kind of do a test and see if they tolerate that. So that's something that we do throughout the day as well. Of course, we answer phone calls constantly to whatever questions doctors might have, nursing might have as well, and that kind of goes on throughout the day as well. We can go on and counsel patients as well on the floors, also throughout the day, or just when we have a free moment. We counsel patients on new medications. We do something called medication reconciliation. And what that is we have to contact the pharmacy that the patient goes to. And we also try to talk to the patient or their family member if the patient's not able to give us an accurate list of what medications they were on prior to admission. So once we talk to the patient or family member, the healthcare proxy, and we talk to the pharmacy that the patient goes to, we sort of see a detailed list of what the medications the patient was on, and we compare that. And if we see any discrepancies of what the doctor ordered, we contact them. So basically, ultimately, we're constantly just trying to improve outcomes, fix any interactions, any discrepancies, and of course, throughout the day, verify orders. Then other things we might do throughout the day, we might be in something called a Vernon Cancer Center, which is in our Newton-Wellesley Hospital, where we are constantly checking chemotherapy. Or another thing is, besides the main pharmacy, we might be scheduled to work in the operating room pharmacy, where we're distributing medications that patients might get prior to surgery, which is another thing that we do. So just
Excellent. Thank you. Excellent. Ronnie, typical day for you.
Okay, so my day can be very variable depending on what rotation I'm on, especially as a first-year resident. So I'll give you a run through of my day and then maybe the typical day for some of the more common specialties. So for me, if I'm on, for example, inpatient medicine floors, which means I'll be taking care of patients who are admitted in the hospital, my day starts around 6:30 to 6:45. Come to the hospital, I'll go through the data for the day, which is looking at the chart to see anything that's happened overnight to the patients who are in my list of patients that I'm supposed to take care of, go through the labs that have been drawn, go through the medications, and then we'll do something called rounding, which is when we meet together with other resident physicians, attending physicians, pharmacists, PAs or NPs if they're on the team, and then we go through each patient systematically to see what the interventions we've done for them and during their hospital stay, and what we think is happening, and how we can best address the disease process to treat them and get them out of the hospital. And that takes about anywhere from 2 to 4 hours, depending on which hospital and system you're with. And then around noontime as a resident, I have an hour of protected teaching time where I go to a conference where lunch is catered, which is great. And we listen to lectures from various different experts from different fields who teach us about topics that are relevant to our specialty. And then in the afternoon, which depending on your call schedule, you can stay anywhere from 1 to 5 to as late as 7 or 8 p.m. You take care of all the tasks you were supposed to take care of for the day, call out the consultants, check up on your patients in the afternoon to make sure that everything they need is taken care of, talk to the other staff members, nursing, pharmacy, and then hand off to the night team who will take care of the patient throughout the night. And that's a typical inpatient schedule. In the emergency room, for example, you'll be taking care of patients who come in with an emergent complaint. You quickly triage them to make sure there's nothing life-threatening going on, and take care of them, either admit them or give them guidelines on how to take care of their problems outpatient. And if I'm on, for example, ambulatory medicine, I do something that's more typical of Francis's schedule with patients who walk into clinic. So it is very variable. And I guess the one other big thing which I haven't really done so far, which is something that Emily could talk to, is the schedule on surgery, which it starts a little earlier, around 5 or 6. You, depending on the day of the week, you could be rounding on patients, the entire list of surgical patients. The OR opens at around 7 a.m. and I think it's between 7 to 3 or 4 that you're operating with other surgeons, taking care of cases for the day, and then you round some more in the afternoon and make sure everybody's tucked in and you get to go home. So
Excellent. Emily.
Yes. So my day typically starts pretty early. So to clarify, I'm a surgery PA. I chose to go into this knowing that these would be the hours. There are lots of different specialties that people can go into that do not have hours like I do. But I really enjoy my hours. I work 3 13-hour shifts. So my day typically starts at around 5:30 in the morning is when I get to the hospital. I look through patient charts, similar to what Ronnie was saying. I look through all the data, see, what happened overnight, what's going on with my patients. And then around 6 a.m. is when we start rounding on our patients. So we run around with a team of interns, senior residents, and students. There's usually a pretty big pack of us that go from room to room, seeing all of our patients and kind of seeing how they're doing and deciding on what our plan is going to be for the day. That usually takes about an hour to an hour and a half. At which point we talk with the attending surgeon. We make sure that our plans are sound, that they like what we're doing. They'll make any adjustments to our plans as they desire. And then at that point, we basically start to implement our plans. So we might contact consultants. I might talk to the pharmacy about medication changes. I might get a psych consult. I might get a cardiology consult for a patient. I start writing notes. I write lots of notes. And then depending on the day and depending on the OR scheduling, I might go into the OR, help out with cases, as needed. And then throughout the day, seeing consults, so seeing new patients that come in who have surgical problems. Someone comes in with appendicitis, I might go see them in the ED, I might talk to the attending, and then they might go right to surgery. And then just kind of dealing with problems as they come up. I also log into Volt. I, hear about problems with patients throughout the day, make changes to their medications and plans as needed, and kind of go from there. And then in the evening, I'm usually, the night team gets there at 6 p.m. So I sign up to them and I'm usually able to get out of the hospital by 6:30. Sometimes it's longer. Sometimes it's pretty quick. It just depends on the day. We can have a patient list of anywhere from, I might have anywhere from 8 patients to 20 that I'm kind of like helping to manage. So it honestly just depends on the day and how busy the hospital is, which lately it's been very busy. So
yes, it has been very.
Yes.
Excellent. Thank you. And Jennifer.
Yeah, so my days, they also do vary a bit, but they also tend to touch on lots of different areas of psychology throughout the day. So depending upon the day, for example, if it's a clinic day and I have a child coming in for a psychological evaluation, there may be days that I see only one patient, but I spend 6 hours with that one child for the day. And so there will be days where I do that, and I really love that. Then there will be other days where we have, other types of appointments that I'll see patients for that, I'll see, several patients in a day. And then, making sure that we're getting back to patients who have questions or urgent concerns. And then also appointments where I'm going back to have feedback meetings with patients and families about the findings of assessments or evaluations that we did. Seeing patients and parents through all the different kinds of programs in our clinic, then also through the Cancer Center, through our PACT program. And then also I'm really fortunate that I have the opportunity to be the program manager and director of school outreach for one of our public health initiatives at the hospital. So I do spend quite a bit of time talking with people in the community, talking with our local schools, consulting to schools, providing professional development, doing a lot of public speaking, program development, building some different programs, new programs within our the Resilience Project is our public health initiative. So building new programs within that, meeting with my peers, talking about cases, those kinds of things. So it does shift gears a bit throughout the day, but that's one of the things I enjoy most, is that I get to touch on all those different pieces. In terms of hours, it does change a bit day to day. So there can be some flexibility with that depending upon, what the schedule for the day looks like and how much time I'll need for different things.
Excellent. Thank you so much. So we are just about out of time. I still have a million more questions. I could talk to you guys for another hour and a half, but I'm sure you're all tired after your long day. So I really appreciate you doing this. I would like to end it with, I think it will be a quick question that I'll just do round robin to everybody is, what is your favorite thing and maybe your least favorite thing about the role that you have, because there's always a least favorite thing. So Frances, I'll start with you. What's the best and the, I don't want to say worst, least favorite?
The best thing is definitely making a quality connection with the patient, figuring out what their problem is and helping them feel better. I mean, that's the best thing about it. Probably the least favorite thing would be the time spent on the computer documenting. Very important, but very time consuming and not terribly enjoyable.
As the person whose team provides you that computer information, I don't take offense to that. That is what we hear all the time. Documentation. Nobody likes it. Lena.
Yeah, so my favorite thing is probably when I see that patients end up having good outcomes, if we made a difference, if we recommended or changed something in their therapy, and it ended up working. So we sort of, helped a patient out in that way. And again, the opposite, something that probably least favorite is if there's some kind of error that we make, because, we're all big part of one team. And if something is ordered and it's not really, we can't really follow things by textbook. So sometimes it's just what we think is best, just sort of in our experience. And if that doesn't end up working, then that of course is very disappointing if there's some kind of adverse reaction that a patient ends up getting.
Excellent, thank you. Ronnie.
I'll start off with the thing I like the least and then end up with
Okay.
the thing I like the most, so it's not overshadowing one. I guess the least favorite thing would be is the fact that all the sacrifices I've had to make outside of medicine to be able to facilitate my education. Many missed birthdays, holidays, weddings. There have been times where I've had to be away from family for extended periods of time. So that's, just things outside of medicine that I've had to give up. But I guess the most favorite thing, and that's something that I really got to experience this year, is the intimate connection you're able to form with another person. It's really a privilege to be able to take care of people in such intimate settings where they trust you completely, and you're able to do something to help them and to make them feel better. And that's a feeling that I cherish and value every day. So
Excellent, that's great. Emily.
I think my least favorite part of the job, obviously, like, you have some sad cases that you have to deal with, especially being in surgery. There are some cases that can be really challenging. You lose patients every once in a while. It fortunately hasn't happened a lot to me, but there are a few patients that have definitely, kind of grabbed onto my heart, and it was, some tough cases, and that can be very challenging. But I think that kind of brings me to the best part of my job, which is my team. I love my team. I think everyone works together so well to provide like the best patient care we can. And, especially when I am having a rough day, or having, a tough time with, a certain patient and, not being able to figure out exactly what's going on, they're always kind of there. So I think that that's my favorite part of the job.
Awesome, thank you. And Jennifer.
Yeah, I think that, my favorite part of my job is absolutely developing relationships with patients and their families, and also with my colleagues, really getting to know people, and feeling like, we're making a contribution toward, improving their lives for the better, and then watching people develop over time and seeing that improvement over time. I think probably my least favorite part is that, there are moments where we have to have the responsibility to deliver news to patients or parents of patients that is not good news. And, that if we feel like there is a very serious concern or a poor prognosis is likely, those are really tough conversations. And it's really challenging sometimes to sit with families during those moments. But it's also, something that, like Ronnie said, that it's a real privilege to be able to do, to be able to help people in those moments, but those moments are tough.
Yeah, excellent. Well, I think that was a great way to end our session. So a huge thank you to all of our panelists. You guys did an amazing job tonight. I appreciate you sharing so much of your experiences. And I think from the comments that we're seeing, we were able to share a lot of great information about the roles that you do. So on behalf of the Workforce Development Council and Newton-Wellesley Hospital, I want to thank everyone who was an attendee tonight and participated in the session. We hope that you found it informative and can help you think about your future career journey. We invite you all to join us for the additional 3 sessions that we have that will focus on other career sessions. We will send an email to all of the registered attendees for tonight's session with a copy of the recording. So I just want to thank everyone so much. I appreciate it, and have a great night.